Hello everyone. Good evening and welcome to tonight's webinar. I am Dr. Rachel Heussner and we're going to be talking about stress and cognition and how that is impacting your brain health. So thank you everyone for joining us tonight. Just a quick few reminders here. There will be a replay afterwards, so you will get a link for the replay and then any information that we have from today's webinar. You also can put any questions that you have into the Q&A. That allows me to just direct your questions there so that at the end of today, when we go through all of your questions, I'll know they're all in one spot. And thank you everyone for introducing yourself. I'm very excited to talk about today's topic. And without further ado, I want to jump right in. So I want to talk about Lou. Lou was a patient of mine, or she still is. She came into my office. I want to say she was around 62 at the time she came in. And she was brought in by her daughter because she started to notice that her daughter noticed that she was forgetting her grandkids' names. So that was new for her. Lou worked in finance. She did accounting for this big company. Always was good with math. And she noticed that her math skills were starting to decrease and she wasn't as sharp as she was normally at work. When her daughter brought her in, they talked a lot about the stress at work and the stress at home, the stress being a grandmother, being with her grandkids. But most notably, what they talked about was about a year prior, her husband passed away. So it was a tough year. They obviously had a lot of things, logistics to work through from that. But she really started to notice that her mom was withdrawing from being with her friends. She did like a bunco group that she wasn't doing anymore. And it was starting to impact her and her family. She was forgetting her grandkids' names. So they came in to see me. We did a MOCA. She was experiencing some mild cognitive impairment. Her score was at 23 out of 30. And, we did some toxin testing, but really what I wanted to look at was what is your stress like? If you just lost your husband, if you've had all these big changes happening, what does that look like? So I ran something on her called an adrenal stress index, or ASI. And this was what we saw. This blue line is her cortisol levels. So cortisol is your stress hormone. And this green patch here, this green area, that's where we want to see. That's the normal range of where we wanted to see her cortisol. So you can see she is way out of it. She kind of dips down around 4 p.m., around that time that she's actually coming home from work, but she's waking up, she's going to work really stressed, high throughout the whole day, and then coming up again at night. And she, of course, was having insomnia. And I think she would say she slept about 4 hours a night total. So it was no wonder that she wasn't as sharp as she normally was. So this is just one example, and that we had really good results with her by really just working on stress. Her daughter took her to this retreat where they did meditation and breath work and yoga. She decided, I finally need a week away from work. I need to work on this. And she said that was the first time she felt like her head was clear again. So they decided to then implement some of those things into her daily routines and do some stress management, some things that we'll talk about today. And then really big for her was getting into therapy and really working with that grief that she had been putting off for quite some time. And when I saw her again, she said, I'm back at work. I'm not having those same retrieval issues that she was having before. That was kind of setting her back on her work and taking some time to do things that she normally could do really quickly, and was remembering her grandkids' names again. And then her daughter shared with me also that she was back in her bunco group. So back to her normal functioning. Even her MOCA score did go up to a 25. So just in that small amount of time, we got her from a 23 to a 25. And then 26 is considered normal. So we were almost there. And this is just one example, right? I mean, I'm sure so many people tonight, even just put in the chat, people that can, yeah, I'm just reading the chat now, but oh, I'm so sorry. My volume, let me just, is this any better? Can someone tell me if this is better? Ooh, okay. Thank you. Thank you so much. I apologize for the audio. If that happens again, someone just let me know. But it's great. Thank you, everyone. It sounds like this is something that most people have experienced, right? Um, I know I see patients come in at just significantly younger and younger ages that are diagnosed with Alzheimer's or even just dementia in general, but even early onset Alzheimer's. And they're in their late 50s, early 60s. The common thread that I see among so many of these patients is this profound stress in their life, profound trauma in their life. So if this sounds like you, if you've had chronic stress, if you are a caregiver, if you have a loved one with dementia, if you're noticing cognitive decline and you want to protect your brain from chronic stress, then this is the talk for you tonight. Okay. So, what will you get from today? I hope that by the end of tonight, what you walk away with is a profound and deep understanding of what stress does to your brain and how you can protect it. So, tangible things that you can walk away with that will minimize stress, lower your stress levels, and protect your brain from the effects of stress. So, let's talk about it. What is stress? Stress is this physiologic response of our body to a challenge, and that challenge can be psychological, it can be physical, it can be mental, it can be emotional, and it activates this HPA axis, this hypothalamus pituitary adrenal axis. So we have our hypothalamus, it detects the threat, detects the stress, talks to the pituitary, which then talks to the adrenals, and that those adrenals then spit out cortisol, our stress hormone, and DHEA. Also makes things like adrenaline and norepinephrine and those chemicals that activate our stress response, our fight or flight system of that sympathetic nervous system. So we're on guard, we're ready to run away from the tiger, as they classically say, right? It's our body responding to a stress with those chemicals and hormones. There's different types of stress. There's acute stress. So that's like if you are on the highway and you narrowly avoid an accident, right? That's a quick response that you have. I'm sure we've all felt this. Our heart starts pounding. We feel like we're kind of breathing more shallow. That's an acute stress moment where it's activating this system and we are becoming more alert and more focused. Chronic stress is just this chronic activation of this system, chronic activation of that sympathetic nervous system. And that could be things like you're chronically stressed from work, or maybe there's something going on with your family life, or maybe it's you have a chronic condition that is stressful. And then there's eustress. Eustress is good stress. Eustress is stress that's beneficial for us. Stress like excitement or nervousness before a performance. It actually can increase energy. It can take us from being very tired to more awake and alert. It's positive if used correctly. If that can go over and over and over again, then that can turn into chronic stress. But what I'm trying to tell you here is not all stress is bad stress. So let's talk about how that is, or what exactly cortisol is doing, right? So cortisol, like I said, is our stress hormone, and it's not always bad. We actually need it. We need it in a great amount, a good amount of that Goldilocks region is what I like to call it, where we don't want too much and we don't want too little. This picture here on the left-hand side, this is showing your circadian rhythm. So this is your natural sleep-wake cycle. So in the morning around 6 a.m., when you're waking up, when the sun is coming into the room, coming into your eyes, that actually should cause this cortisol to naturally spike, this pink line, and that becomes more alert, more awake, gives you motivation throughout the day, motivation to get out of bed, energy for your day. Okay. And then it should decrease throughout the day, decrease into the night when then melatonin spikes. And then you can use that for sleep, your sleep hormone. So this is your circadian rhythm. This is what naturally is supposed to happen. So short term, when we have small amounts of cortisol, that's good, right? Like I said, it helps with energy for your day. It helps with mood, with motivation. Back to what we were talking about with eustress, it can enhance performance and focus. Your body actually cannot tell the difference between excitement and bad stress. So it's the same mechanism that we see, that same HPA axis gets activated when we're excited, or even when we're nervous or when we're scared, but it's the way we perceive it. So short term, it's actually good. We need it. It enhances our performance, our alertness. It actually helps cope with stress, and it can modulate the immune response. But if we are having this chronic exposure to cortisol and stress, that can actually suppress the immune system. It can lead to chronic inflammation and chronic inflammatory diseases like autoimmune conditions. It can actually cause you to then store more fat or adipose tissue around the belly, around the abdomen. That is what we call visceral fat. So that can lead to things like obesity. It can lead to type 2 diabetes. Cortisol itself can narrow the arteries, so that can increase heart rate. It can increase blood pressure. That can lead to things like stroke or heart disease, hypertension or high blood pressure. It can break down the muscles, actually. It's a way that our body wants to utilize energy by breaking down the muscles for energy, which can lead to muscle wasting, can inhibit calcium absorption. So our bones start to break down. We have bone density loss, which can lead to osteopenia, osteoporosis. It can alter the level of stomach acid that we have, which will not only impair how much nutrients we're absorbing and how we're breaking down food, but lead to more GI issues like IBS or GERD or reflux. It will affect sleep. I mean, we saw that with Lou, right? If we had that blip at night of the cortisol, that spiking at night, that's going to cause things like insomnia. It can cause you to not have good quality sleep. You're not going to be getting into those restful, deep stages of sleep. It can fluctuate your sex hormones, specifically estrogen and testosterone. I classically tell my patients, especially when they come in for low libido, I say, what is your stress level? Because stress is the classic stealer of testosterone, of your libido. It can increase this protein here, SHBG, sex hormone binding globulin. It's a protein that it does what the name says. It binds up your sex hormones. So it has an affinity for testosterone. So classically, I see these people come in, they have lower testosterone, their sex hormone binding globulin is high, they're often very stressed. So that can look like low libido, low motivation, difficulty putting on like good lean muscle mass. And then estrogen wise too, it can cause symptoms of low estrogen, those menopausal type symptoms, hot flashes, night sweats, mood fluctuations, weight gain, can affect the thyroid. So thyroid conditions, hypothyroid, where we see fatigue, weight gain, constipation, hair loss. And then, of course, can affect cognition. When we are running from the tiger in our brains, right? When our body is responding to stress, it's like this classic evolutionary viewpoint of, I have to run from this tiger. And that's what our nervous system thinks in order to survive. Our body is not going to then give energy and resources to consolidating memories and learning new things and forming new neurotransmitters. It's going to put all of the resources into that stress response. So what exactly is happening in the brain? What is this stress-brain connection? Well, when we have chronic exposure to stress, and to cortisol, we call that allostatic load. It's that buildup when we are repeatedly exposed to it, and that can cause wear and tear. Again, we're allocating all of our resources to these coping mechanisms for stress. That's going to limit our resources for other mental tasks like memory retrieval and making sound decisions and learning new things and making new synapses. So specifically what we see in the brain is a decrease in memory, concentration, and learning. We see an increase in anxiety, depression, and mood swings. And we see a decrease in cognitive performance. So this was a cool study I found where they looked at the brains of stressed and unstressed people. I forget exactly what stressor they used, but they did it in a control setting. And with the unstressed, what they found was they had normal amounts of these chemical messengers going through the prefrontal cortex. So they had better control of their thoughts, of their emotions, of their actions. But when they were stressed, when they had that control stressor, they had an uncontrollable amount of chemical messengers going to the prefrontal cortex and then stimulating parts like the amygdala, which is our emotional reactivity center. So they had weaker control of thoughts, emotions, and actions. So what they find is that through this research, we don't make good decisions and we have poor judgment when we are stressed. I'm sure plenty of us can think of a time where we didn't make the greatest decision when we were under a lot of stress. Because what they see is that we tend to have more impulsive type behavior, and we just naturally go more towards an addictive type of decision making and poor judgment when we're stressed. So something to think about, right? About taking a moment. If you have a big decision to make, do not do it when you are stressed. And then, of course, all of this can lead to emotional exhaustion and burnout. And that can look like, the anxiety, the depression, the mood swings, the poor judgment. So it's crucial that we get on top of stress before these things start to happen. So how is it more associated with cognitive decline? Well, there's 3 areas of the brain that are really affected. The first is the hippocampus. So we find that in studies, the actual hippocampal volume of chronically stressed patients will be lower. And that's what we see in things like Alzheimer's as well on MRIs, that the hippocampal volume will be lower. There'll be less neurons formed in the hippocampus, and that's our memory and learning center. So that's quite important for cognition. And same with the prefrontal cortex, like we saw on the previous slide. Actually, they find that neuronal cells are less likely to survive in the prefrontal cortex with chronic stress. So that affects your decision making, your executive functioning skills, how well you can pay attention and focus, have motivation, regulate your emotions. And then lastly, the amygdala, which we also saw before. Like I said, that's where we tend to have our emotional reactivity center. And that one actually gets bigger with chronic stress. So this is more like our primitive innate, we call it like our primitive brain. When this is activated, we become heightened and more reactive to things. And that doesn't always mean in a good way. That actually means we're becoming more reactive, where we can increase anxiety and stress. And anger, those more negative emotions tend to erupt at this time. So another study that I thought was interesting looked at, there was this virtual town and they wanted patients to draw a line or a path going from this start line to this target object. And again, they did it with no stress and with stress. And they actually, with the stress on this time, it was with a moderate electric shock. So a little bit of physical stress and emotional stress there. But what they found was really interesting, that these people, when they were under no stress, they could easily, make a quick decision where It was an effective path going from start to target object that was short and effective. But when they were under stress, they tend to go this more familiar route, which wasn't as effective and longer. So that's going back again. You're going to make poorer judgments, have worse decision-making skills when you are under stress. And that can be because your emotional reaction center is activated in the amygdala. You're stressed out, you have more anxiety, you can't pay attention, you can't use your prefrontal cortex appropriately. Your memory retrieval from the hippocampus isn't going to be as activated, and you're going to then have poorer judgment. So again, how is this related to cognitive decline? I really want you all to have a good understanding of how stress can affect the brain, because I find that's how then we are more motivated to make a difference, right? And more motivated to work on things like our stress. So a quick overview: chronic stress can lead to inflammation. We saw that it can cause things like autoimmune conditions and chronic inflammatory conditions, but that can cause neurodegeneration, that can cause neuronal damage, and cause amyloid plaque to build up, which will then increase your risk of Alzheimer's. Can also suppress neurogenesis. We need new neurons to constantly be made, to constantly be firing together, so that way we can transmit information in our brain and nervous system. And we see that particularly in the hippocampus, where we have our memory and learning center. It can also decrease cerebrovascular volume and actually have the blood-brain barrier become a bit more permeable, a bit more leaky. So again, more neurodegeneration can occur from there. And then reduce synaptic plasticity. So we have less synapses that we're going to be forming, less information that's going to be traveling through our brain and nervous system. All of these, which can lead to cognitive decline and eventually things like Alzheimer's and dementia. So I hope by this point we have an understanding of how stress affects the brain, right? But what can we do about it? So I talk with my patients a lot about what we can do in the moment for stress, right? What we can build in our toolbox to help lower stress, and then what we can do to prevent that and to get ahead of the ball there and ahead of the game. So mindfulness, meditation, relaxation exercises, these are the classic stress management tools that are often talked about. Meditation is always going to be number one, right? There's so much research that shows how meditation can lower cortisol, can lower stress, can actually lower and decrease size of the amygdala and make it less reactive to stress. There's so many studies done on meditation experts and the size of their amygdala over time and how it's decreased and become less reactive. Some of my favorite apps for meditation are Insight Timer, Balance, Headspace, or Calm. And then deep breathing. This is something that we can all do more of. Deep breathing is, I like to think of activating the parasympathetic nervous system, activating that vagal nerve that goes into your parasympathetic, which is that restful phase of your nervous system. Breathing is actually the one thing that we can have control over of our physiology, right? We don't really have control of our heart rate and our blood pressure all the time. We can't directly control it, but we can control our breath, and we can control how deep we're breathing, how shallow we're breathing, how quickly we're breathing, and that can activate the right part of our nervous system. So there's 4-7-8 breathing. This is where you breathe in for 4 counts, you hold for 7, you breathe out for 8. That longer exhale actually is associated with activating that nervous system. Again, that's that restful phase, activating the vagal nerve to get into that restful phase. There's box breathing. So some apps, some websites will literally show you a box and have you follow it. Or you can kind of count where you breathe in for 4, hold for 4, breathe out for 4, hold for 4. And then there's belly breathing. So I can tell I'm doing this right now, breathing from my chest. That's really common. That will be shallow breathing, breathing from our chest throughout the day. And just having awareness of it is the first step, right? We can kind of stop and think, okay, where am I breathing from right now? But that can lead to more hyperventilating, and then that will kind of perpetuate the stress response if we're breathing from here. So we can kind of do it right now, but everyone put their hand in your belly and kind of breathe in all the way, get that breath all the way to your belly. Sometimes it helps if you put your hands on your rib cage and feel your rib cage expand. That's how you know you're deep enough. And then you can squeeze your abdominal muscles to exhale it all out. And that's belly breathing. That's also called diaphragmatic breathing, really wanting to get out of the chest and into the belly. Some other practices are things like yoga, Tai Chi, progressive muscle relaxation. These are all ways that we can be moving energy through us, right? When we're stressed out, it's good to kind of move it through us. But then also using your breath to body connection. So that's really big in things like yoga. You're using the breath to get through some of these poses. If that's limiting for you, you could even, if movement's a bit limited, you can do things like chair yoga where you don't have to be doing downward dog and different poses like that, but still getting into some yoga moves. Progressive muscle relaxation is more to activate certain muscles and then force them to relax. So all of these will help activate the parasympathetic and decrease cortisol levels. Gratitude, positive thinking, journaling, just getting it out of your head for a moment can be really, really beneficial. A prayer practice, yoga nidra. This is actually not so much a yoga practice, but a more of a guided meditation where you're progressively relaxing, almost like progressive muscle relaxation. It's really common to do before bed, or if you're in a stressed out situation and you're commonly lying down with your eyes closed. And then there's the Kirtan Kriya. So this is one of my favorites. This is a common meditation. And if you are a patient of ours, or if you've read Dr. Sanderson's book, you know this is one that we commonly talk about with patients. It's a meditation. It's 12 minutes. You can find it on YouTube, but it involves different chanting and singing and using, touching your different fingers to keep attention, keep energy moving. But it has one of the best, most studied meditations for Alzheimer's and for cognitive decline. So it decreases stress, but it also is activating these parts of the brain to help with cognition. So we have some great things that we can do in the moment for stress, but we have to also talk about building up your resilience. I love this photo where you can see it. This person is grounded into the earth. And so think of resilience as your grounding mechanisms, your ways that your nervous system can deal with that external stress. Because we can't always limit, right? Everything that's happening externally, but we can control how our body and our nervous system responds to it. So the first and foremost, is prepare. My track coach drilled into me in high school this quote from Benjamin Franklin, that failing to prepare is preparing for failure. And the same can go when we're thinking about stress in our daily lives. If we don't prepare, then we're preparing for failure, because stress is not going anywhere. Our stressors, they'll be there. Yes, we should do things to limit them so that way we have boundaries and healthy amounts of stress. But we have to talk about how we can prepare ourselves. I talk to my patients a lot about getting your armor, preparing your armor for the day, for getting your armor for your nervous system. So that way you are prepared for those random things that can be thrown at you and not be so reactive to them. And what I really like to start with are just plain old routines, right? a morning routine. I specifically say morning routines because this is when you can make yourself prepared for the day. You can build up your armor for the day. You can also increase your energy for the day, increase your bandwidth so that way you can feel more stress and not be so reactive to it. This is a great time for you to incorporate things from this slide, right? The Kirtan Kriya, a meditation app, some movement like yoga or exercise in general to just get the brain moving. That helps with cortisol levels as well. But I like to say, try to get it just 5 minutes of something that's self-care, 5 minutes, and then some type of movement. So journaling, meditation, something, and then if you can get some movement in there. Another thing too is start with decluttering your space. Start with just getting organized. So having a messy room, having a messy house in general, having too much around you can just subconsciously cause us to feel more stressed. So having just more simplicity in our environment can actually help reduce cortisol levels and build more resilience. Get organized. So plan out what you can take control of, figure out what that is and take control of it. Does that mean that you plan out your meals for the week or you meal prep in advance for the week because you might be low on time and you need to have your meals ready for breakfast, lunch, and dinner? Does that mean that we have to plan out when you're going to get your exercise in or plan out when you're going to get your self-care in? Get organized for those things. Plan out when you are going to have, your work blocks in the day. And then when you have your rest, when you have your self-care, so you can plan your days, plan your weeks, somehow do that so that way you can take control of what's controllable. And then, of course, we need balance. So we can't control everything, but we can try to set boundaries on some things to prevent burnout. Something that's really interesting is that we can change our attitude around stress and towards stress. So there was a study that looked at people that had a good attitude about their stress from work and how they were able to challenge themselves and deal with the stress at work compared to those that thought of it as a negative attitude towards stress. But what was more interesting to me was this study they did on Navy SEALs. And they found that the Navy SEALs going through training who thought of the stress of training as beneficial for them finished that whole training more than those that thought of it as a negative attitude towards their stress. So it can literally change even your physical output, right? And just how you are dealing with stress. There's different brain retraining programs. So this is also a common thing that I talk with my patients about, that we can change that negative thought process that we kind of go through when we are stuck in this loop, especially if you are experiencing a chronic condition. These different programs online like Gupta, Primal Trust, DNRS, or Dynamic Neural Retraining System, these are all great for helping you learn to meditate, learn to break that negative cycle, and how to use it for getting out of flares, getting out of any kind of negative thought cycle. Gratitude, positive thinking, it's again just kind of shifting the way that brain is circuiting into a more positive, less negative. Breath work, relaxation, those things are great for in the moment for decreasing stress. But the more that you can do that, even when you're not stressed, you're preparing your body and you're building that armor. Mentally stimulating activities. So puzzles, brain games, brain HQ, those things are actually helping to enhance our resiliency to stress, right? There's a little bit of stress that comes with doing those types of brain games that can be like eustress, where it's then used as a positive for enhancing cognition, decreasing stress in the end, and making more resiliency. CBT or cognitive behavioral therapy or other forms of therapy, we gotta talk to some people sometimes, right? There's so much going on. We gotta get out of our own heads. CBT or cognitive behavioral therapy is a specific type of psychotherapy that helps you to identify the dysfunctional like thought patterns and behaviors and actions that you might have, and then how to get out of those and rewire them. Get into nature. So we know how grounding, just getting our feet in the ground and getting to the beach or getting on the sand, how that can also, the grounding of that can help our nervous system to become more resilient. Cold water immersion. So literally getting into cold water, getting into an ice bath, or ending your showers on cold. You can start with about 5-10 seconds and work your way up to a minute if that's possible on a cold, cold as you can go in that shower. That can also build resilience. That's great for the nervous system. That's this hormetic effect where we have a little bit of stress to then build that resilience. That goes with that mental stimulation. All of that is this hormetic effect that can then build resilience in the end. And then red light therapy. Red light therapy is wonderful for decreasing inflammation that can be caused from stress, specifically neuroinflammation. It's great for decreasing oxidative stress, and then it can actually decrease some of those brain waves that are associated with anxiety. And there's the ones that you can wear in the head. There's like the Violet, it has the little nose clip that uses red light therapy. We use that a lot for cognitive decline in dementia patients. Okay, so what can we do with our lifestyle to make us more resilient as well, to deal with stress better? Well, we can have a good diet. So, blood sugar balancing diet, a diet that's not going to put us on a roller coaster throughout the day. So, there's a huge link between our blood sugar and our cortisol levels. We want to make sure that we're having enough fat, enough protein to keep our blood sugar balanced so we don't have spikes of cortisol as well. There's studies that show that if you have diets high in omega-3s, vitamins like vitamin A, which you can get from your colorful vegetables, carotenoids, then you can make more BDNF or brain-derived nootropic factor, which is like fertilizer for the brain. So increasing your brain plasticity and your neurons and neurogenesis. Probiotics, we want to have a good gut health. So a diet that has good fermented foods, that will feed the good microbiota, so that way we can continue to make good neurotransmitters in the gut. Antioxidants, so we can combat the oxidative stress and inflammation that's caused by cortisol. And then lots of good protein. So when we're stressed out, like I said, you can actually break down muscles. So we want to make sure we have enough protein there to build up muscle. And then it's also, we need plenty of protein to get amino acids to make neurotransmitters. Good sleep. So we saw with Lou too, she wasn't sleeping. So she wasn't able to really handle stress, anything that could be thrown at her. So I did a webinar a few months ago on sleep. That's on our website. Go listen there if you want some more in-depth tips and supplements on how to sleep better. But you can, wake with the sun. That's a great way to stimulate a healthy cortisol response. The light through your eyes will help regulate cortisol. And that's, it's just a simple way that we can regulate our cortisol in the morning. But having a good routine, again, our nervous system, our brains like routines. So having a good nighttime routine, you can get into that restful stage, because we want to get good quality sleep. So it's not about just getting enough sleep to deal with stress, but getting enough of that REM and deep sleep so our brain can recover and have more resilience. Exercise. So exercise increases blood flow to the brain. It decreases cortisol, it increases BDNF again. It's just, exercise is wonderful for stress, wonderful for protecting our brain from the effects of stress. So great to do a mix of aerobic and resistance training, but sometimes you'll see They're even just walking and gentle weightlifting or gentle yoga, gentle Pilates, something that's not high intensity might be more of what you need if you are very, very, very stressed. There's some people that walk into my office, they are, they're dealing with little toddlers and they have so much stress. Maybe they're a single mom and they have so much going on. I can just see the cortisol pumping through them. And they're also going and doing these HIIT classes, and I tell them we got to back down there because that physical stress is also coming from working out. We want to lower that. That can also be raising cortisol. So doing more gentle things to help support the adrenals, like gentle weightlifting, not getting your heart rate too high up, gentle yoga, gentle walking. And then avoid excessive alcohol, avoid smoking, avoid exposure to environmental toxins. Those things are going to make you less resilient to stress. Things like mold or mycotoxins that can be found in the home, those are neurotoxins. So that's, of course, going to affect the nervous system and stress response. Reduce caffeine. That can cause more cortisol to be put out in some people, especially if drinking on an empty stomach. You can switch to things like matcha. Matcha is like a potent green tea powder. It's really high in antioxidants, and it's also naturally has things like L-theanine, which is an amino acid to help with calming of the nervous system. So you can get that caffeinated effect without being so stimulated and kind of stressed out and have that cortisol response. Social connection. So I can't go without talking about the importance of a strong social network to improve mental health and lower stress. In the Lancet, it's actually social isolation is a modifiable risk factor for dementia. So often I'm asking, who's on your team? Who is your support system? What does your wheel of life look like? What do your relationships look like with people? What does your relationship to work look like? What about yourself? Do we need to increase this social connection part of it? And that's specifically important for caregivers. We want to prevent caregiver burnout. So sharing the load of stress and having people to talk to and connect with is vital to prevent burnout. So we can look at your local community centers. You can get involved in classes if you like cooking classes, arts, different art classes, game nights. Lou loved her Banco night with her girls, and that social connection that you get from there is very important. I mean, we saw what COVID did to so many people, right? Because they lacked that social connection. And I can't tell you how many times people come into my office and say, they weren't the same since COVID, since they spent time inside and were isolated. Join some clubs, book clubs, different ones that could be offered from your local community center. Look at libraries, go to the park, go to dog parks, engage with other people. Quickly, I'll go over some herbs and nutrients that can be used to help with lowering stress and prevent the brain from having neurodegeneration from stress. So there's adaptogens. These are things that protect the adrenals and actually increase resiliency of the nervous system. Licorice, rhodiola, mushrooms like lion's mane. We want antioxidants to fight inflammation. So EGCG, that's a big nutrient in things like green tea. Vitamin E or curcumin, omega-3 fatty acids. We know those are very neuroprotective. You have nervines, things like passion flower, chamomile. Those actually work on the nervous system to help decrease things like anxiety and slow down the nervous system. Your amino acids are going to help build with building blocks of neurotransmitters, so help produce more dopamine and neurotransmitters that are related to a healthier mood and calming down of the nervous system. Glycine, like L-theanine, that's found in green tea. Vitamin C is so nutritive of the adrenals. Vitamin D and B vitamins have actually been shown to help prevent cognitive decline, and we use them both up really fast when we're stressed. Magnesium helps protect the nervous system. Zinc is very neuroprotective. It's actually used a lot in our depression cases and helps with neurotransmitter synthesis. Phosphatidylserine, this is a big lipid that we use to help break down cortisol. And then there's some other herbs here like saffron, lavender, bacopa, all of which have been really well studied to offer neuroprotection and protect the brain during stress, during inflammation, and help with cognition. Ginkgo actually helps increase blood flow to the brain, so that can help with cognition and inflammation. And then glandulars are specific ones that we use if you actually have cortisol that's too low. So it's interesting because this test can be really helpful when we're not exactly sure what's happening with the cortisol. We want to see what this pattern looks like in a person. And sometimes you're below the line, right? We talked about you want to be in that Goldilocks region. And when people have been through chronic stress, their adrenals can get burnt out and they're not producing enough. So we use things like those glandulars to help increase cortisol. So the adrenal stress index, this is what I use. This is what I use on my patients to help see what's going on with their cortisol. We can also see that there's some other measurable things that are involved in the stress response, like insulin and DHEA. And this is a salivary test. So it's a lot more complete, and we get more from it than we would just from the serum blood test or urine testing. And then we get the whole pattern of it. So we can see what's happening from the morning till the middle of the night. So this month we are offering a test and consult offer. So till the end of the month, if you order the ASI, you can also get a free consult with me for $295, normally $445. And then we'll put the link for that in the chat. And that's all I have for you. So I know there was a lot of information, but I really hope that everyone has a really good, deep understanding now of how stress impacts the brain and what we can do to lower stress and protect our brain from stress, because that stress is not going anywhere. So I'm going to take a look at the chat. I hope you all got some good information from this. If you have any questions, put them in the Q&A. I know someone wanted to go back to the supplements, so I'll go back there. And just a quick word on the supplements. Not all of these are going to be appropriate for everyone. You know, someone had mentioned, you know, for example, licorice raises blood pressure. So if you have blood pressure issues, I don't want you being on licorice. So talk with your doctor, see which ones would be best for you. You know, for example, saffron is really wonderfully studied for being effective in depression and helping increase serotonin. It works almost better in some cases than Lexapro, but that might not be suitable for you if you're already on certain medications. So definitely talk with your doctor first before starting any of these supplements. DGL licorice is one that someone had put in the chat that does not raise blood pressure. That one is commonly used in your like heartburn and reflux supplements. So sometimes you'll see that in the stress support supplements, it's just licorice. It's not the DGL form of the licorice, but that form does not increase or have an effect on blood pressure. So I'm going to look in the Q&A and see what we have here. So can you define inflammation in the body, and what does this mean and what is happening in the body? So inflammation in the body, that's just a really general term, right? It basically is just saying that there is an inflammatory response, which can be these chemical messengers, and we can measure that. We can measure through things like hsCRP, homocysteine, LPPLA2. These are blood markers that are showing inflammation, and that usually leads to a decrease in positive outcomes and increase in negative outcomes. So we'll see a breakdown of tissue, or we'll see that you can have more clotting factors. So it kind of depends on exactly what where the inflammation is happening, but specifically in the brain, when we see inflammation, it can cause neurodegeneration and breakdown of the neurons. Um, any tips for teaching breathing techniques to someone experiencing dementia? That's a great question. Um, so that it's not always possible. Um, with that, I think it comes down to just having them mimic you, and see if they are interested in following what you are doing. So, encouraging them with, we're going to try this. This is something I do to help with stress. And this really makes me feel good, and see if they can mimic you in the technique. It's not going to be perfect, but that kirtan kriya actually tends to be a bit more simplified in rather than teaching a breathing technique, since there's a little bit more activity going on there. How helpful are mushrooms, including lion's mane, for a person already diagnosed with Alzheimer's? It's a great question. They can be really helpful for neurogeneration or neurogenesis. So even though a patient's already diagnosed with Alzheimer's, it doesn't mean that it's not going to be effective. It just means that there's probably other things that need to be done as well, right? It's not that that is the only thing we can rely on, but I still think it would be helpful. Is the stress cognition test and consultation only available for those in your area, or can it be done online? So it can be done online. It is only available for California residents, but it can be done online. You don't have to live in San Diego. Husband is on glutamine for gut health, and they finds that it increases anxiety. What is a good alternative? This is actually something I've seen before, because it can make more glutaminergic activity, which is more excitable. The opposite of that is GABA, which is a more calming neurotransmitter. So that's something that you can do to help with the anxiety. But a good alternative are things like zinc carnosine. Zinc carnosine helps to line and heal the lining of the gut the way glutamine does. Slippery elm, marshmallow, those other like demulcent type herbs are also really wonderful for healing that gut lining. Aloe as well. I'm just gonna see if I missed anything in the chat. Is lion's mane bad for you if you have high blood pressure? It shouldn't be. Like I said, though, everyone's a little different with how they're going to respond to supplements. So it's always best to work with a provider that can help you on this, but I don't see that being an issue if you have high blood pressure. We tried the meditation. So it can still be a useful activity if your spouse is having trouble with matching the fingers, kept falling asleep. I think you should still try it. It's again, not everything is going to work for everyone. If they're at a point where you've tried it multiple times and that activity is still not working for them, then I would try something different. So give it another shot. If that doesn't help, then try something that might be a little less involved, right? If you want to do something like a puzzle or coloring or drawing, something that can still use their attention and use some cognitive skills, but is less processing ability. Does red light therapy affect cancer cells? It can. I'm not too familiar the research on this. I look at red light therapy as more effective for decreasing inflammation. It helps with energy of the cell. So I don't know exactly how it would affect cancer cells, but it is really beneficial for just cell health in general. Okay. Do you see a lot of sleep apnea in your patients, and what do you recommend to address it? That's a great question. Do your obstructive sleep apnea patients exhibit more refractory daytime stress? That is a great question. And yes, we see a lot of sleep apnea. That's actually one of the biggest things that we screen for in our cognitive decline patients. If you have a history of snoring, if you have any issues with sleeping, we ask if you might wake up with your mouth that's dry. Um, or even if you don't, I still would want to screen you for it with an at-home sleep study. So we start with a sleep study. At home would be best. So that way we can get you in your natural environment. It's not the gold standard. Gold standard would be to have you in a sleep study center. But often people do not sleep in those situations. So we use the watch pat, which is a device that you send to the patient's home, and it monitors the oxygenation at night and what sleeping pattern they have if they're getting into different phases of sleep. And then it can show, is this mild, is this moderate, is this severe? At that point, we'd probably send to a sleep specialist so that way they can get a CPAP if it's severe. But if it is mild, usually we can just use some mouth taping to help with that. Some patients need a specific oral device that you can get from your dentist to keep the airway in a certain position so that way you're sleeping appropriately. But it really depends on if this is mild, moderate, severe, and how you can address it from there. But that can make a huge difference once you do address it in overall cognitive abilities and memory retrieval, and yes, stress in general. So someone who's not sleeping well because of sleep apnea is not going to be able to handle stress the way someone can who doesn't have sleep apnea and is sleeping and getting into those stages of sleep appropriately. And then one of the biggest things that I find is that their blood pressure goes down. So there's a lot that can be done from addressing sleep apnea. Could tense and relax be helpful for those with cognitive decline? Again, this one might depend on the person. It does help to stimulate the parasympathetic. So if there's something that they can follow you and follow those instructions and relax appropriately, then yes, it might be helpful for them. Um, difference between green light therapy and red light therapy was recommended green light therapy for migraines. I'm actually not familiar with green light therapy. I'm familiar with things like blue light and red light, and it's just a different wavelength on the light spectrum, and I don't know the exact benefits of it. So that would be a question I would ask your neurologist. Myomunchie, I'm not familiar with that. I like using mouth tape, but it doesn't assure no snoring. I feel better in the morning, so I use it, and it's nice for helping hold your jawline. So yes, it doesn't completely. So I would actually want to address that with a sleep study, right? To see, is this just a mild apnea? Is this something that you may need an oral device for to keep your airway in a certain position? But yes, it can be better for holding your jawline. And then you do usually feel better. People notice too that they're not grinding their teeth as much. All right. So we have another minute or so. Does anyone else have any other questions? Oh, I see. I'm sorry. There's ones in the chat. Um, I can't get to all of these questions, but I would love to answer them for you. So if there is anything that we didn't get to and you have a question, you can always email us. You can always give us a call. But so blood markers, again, for inflammation are things like HSCRP, homocysteine, LPPLA2, that those are just examples of inflammatory markers that we run. Can infrared be helpful? Absolutely. So infrared saunas, for example, are really helpful for detox and can be helpful if you do that before bed to help with relaxation. We talked about some breathing. How does rhythm work in the winter? What time do we sleep and when should we wake up? How many hours a day should we sleep? So that's a great question. It's always best if you can wind down when the sun goes down and start to wake as the sun comes up. So you don't have to go to sleep when the sun goes down, especially in the winter when it goes down fairly early. But you want your circadian rhythm to be around that, where you start to wind down around sunset and then waking up with the sun, or at least be up and have some sunlight in your eyes close to waking up. How many hours you should sleep depends. So around 8 is like the general rule of what I'd like to see. Some people do better with a little more, some people do better with some less. But I definitely like to say if you can get at least 7 to 8, I don't really like to go lower than that. The main ways that we can assess are you sleeping enough is how do you feel in the morning? Do you feel rested? Do you feel like got into those proper restful stages of sleep? So it is a little bit different for everyone, but generally I'd like to say around 8 hours. Um, where's the Q&A? Okay, so looks like we are now out of time and I got to as many questions as I could, but like I said, if there's more that you want to email us, you can go ahead and email. Tyler, thank you so much for putting in the Test Plus Console offer there. You can email us and we'd be happy to help you if you have any questions. I thank you all so much for coming in tonight and be on the lookout for some future webinars. Actually, all of our past webinars are on our website on solsere.com, so you can go ahead and look there. And then you have the link for the replay, and that will also be emailed to you. So I hope you all have a wonderful night. Enjoy the rest of your week and can use some of these for stress management and for building resiliency to stress.